Hi, my name is Holly Edwards, and in this video I will be showing you my video evidence on nursing animals. I will be showing you how I deal with hemorrhaging, fracture/dislocation. I'll also be showing you all of the nursing routines that have been listed down by various different patients, just short clips of me doing each of those with different patients. Cadaver, we have a cat that has been donated for scientific use. So a few of these points I'm going to have to explain instead of showing. One thing that we do need to remember when we're dealing with felines who are in pain is even the nicest cats will be aggressive, so we need to be making sure that we're protecting ourselves first whilst dealing with the cat. So that can be in the form of muzzling, towels, cat scratch gloves, the appropriate PPE to stop us from getting bitten or scratched. Now, to start off with, I'll be getting some of her vital signs. So I'll be using a stethoscope to listen to her heart. I will be checking her respiratory rate, making sure that they are in normal range. If she's trying to get her temperature would be great, but we don't want to cause any additional stress to the animal. So if we can get it, we would. If we're not able to get it, purely to decrease the stress of the cat and to protect ourselves from any aggression, we won't take the temperature. To remember when doing first aid to stop the bleeding. So to stop the bleeding, I will be retrieving some gauze swabs. Now we need to be applying a lot of pressure to the area to stop the bleeding. Using the gauze swabs, I will be pressing down on the area that has the hemorrhaging. Now you always need to remember that if these swabs do get soaked from blood, we never remove the swabs to add more. We just place more swabs on top of the existing ones. That is because a clot can start to form from the pressure of the swabs that are touching the skin. Now, we don't want to be removing those swabs and potentially removing the clot that has started to form in between the skin and the swabs. By putting more on top, we are giving more place for the blood to drip into, and if it is a severe hemorrhage, we just keep on adding the swabs. Now, if it is really extreme, instead of using the swabs, we can use a hand towel to apply pressure, and same with the hand towel. If that does get soaked with blood, we then apply another hand towel over the top. Now, depending on the severity of the hemorrhage, the patient might need to be anaesthetized. It depends on how much blood is lost. We can induce the cat into Alfaxan just to relax the patient enough and to sedate it enough for us to be able to continue to apply first aid. If the cat is overly aggressive, this is most likely an option that we would need to do. Bandaging options for the cat. Obviously, while we are still applying first aid with the gauze swabs, you can keep those there. Now, to wrap them tight, I would use something like vet wrap. Now, if this does get soaked, this isn't going to be adequate. So I would normally use conforming bandage as well, wrap that around initially to keep that nice and tight, and then use vet wrap. Now, if the hemorrhaging is not stopping, the vet wrap and this might need to be replaced. In the next clip, I am showing you how I prepare a site for an IV catheter. I will be inserting the catheter and attaching a Hartmann's fluid bag to the dog. In this short little clip, I am going around and clipping all the dog's nails after he has been anaesthetized. In the next little clip, I'm showing you how I inject a subcutaneous medication. This is a syringe full of Medicam pain relief, and I'm just inserting it underneath the skin. In the next clip, I'm showing you how I'm helping a patient who is going through a little bit of respiratory distress. She is in for a procedure today, and it was decided by myself and another vet that she needed to be pre-oxygenated. Her colour wasn't that great. She was on the paler side, and this was before she had been induced into anaesthetic. So we wanted to pre-oxygenate her just to get her O2 level back to a normal rate, and also the colour of her gums to be at a flesh pink colour. So this is post her procedure. I'm just keeping her on oxygen through the mask. She was a pale colour during the anaesthetic, and she was going even more pale, almost to a white colour after the procedure. So we have decided that we wanted to keep her at least on oxygen for the next 20 minutes. If it got very severe, we would pop her in the oxygen chamber where she would sit there for the rest of the afternoon. Here I am calculating some drug doses of some Medicam. I am calculating on a calculator the dose rate of 0.04 mils per 10 kilos for the weight of this cat. Here is another clip of me giving a subcutaneous injection underneath the skin. Here is another clip of me drawing up some medication. Again, I'll be using a calculator and going off the dose rate that is found on the box. This is a different drug. This is Alfaxan, so just wanted to give another example. This is a clip of me performing a physical examination on this animal before a procedure. So I'm just going over and checking all the vital signs, the gum colour, how clear the eyes and ears are, and noting down the respiratory rate, the heart rate, and the temperature before she is pre-medicated. For a feline that has got a fracture or dislocation, this can be a very painful injury. I would recommend that the cat is anaesthetised for this, and I think a vet would recommend that as well, just to reduce the risk of staff members getting injured, and also to relieve some pain from the bandage that we normally implement after a fracture has been fixed is we apply a Robert Jones bandage. This bandage is used to stabilize the leg and leave the joints in a position where the vet is happy for them to start healing. Now this is a very thick bandage. It can stabilize a whole limb. So if we had fractured a hind limb, for example, it will stabilize the limb in a position that is best for healing. For the next couple of minutes, I'm going to be showing you how I apply a Robert Jones bandage. This is a bandage that would be used to stabilize a fractured limb. Here I am applying the stirrups that go against the skin underneath the bandage. Here I'm cutting the cotton wool to apply as my first layer of the bandage, just sizing up how much cotton wool I will need as this is a small leg. Second layer of the bandage is to wrap it with conforming bandage. This is what I'm doing here. I'm applying a small portion of vet wrap just to the upper bit of the leg. This just keeps the conforming bandage in place. And the final layer of the Robert Jones bandage is to apply elastoplast. We do this from the top of the limb right down to the bottom. This just keeps it nice and secure and so that it won't slip off the leg. Now at the time when dealing with either a fracture or a hemorrhage, I would be constantly in communication with the vet, asking him or her what the next steps are. She or he will give the best recommendation of what is to be done next, making sure that the communication is clear and concise between the both of us, that I'm asking a lot of questions if I'm unsure about anything, double checking on dose calculations for medications that the vet wants to administer, and making sure that I'm understanding of what the next steps are once we have the hemorrhage or fracture under control.